We'll continue to do everything we can to keep this virus from spreading.
We're today calling for mandatory masks in all indoor public spaces.
It makes a remarkable difference. It reduces the spread of this virus.
It may be uncomfortable. It may look unusual. It may take you out of your comfort zone.
We may be done with the pandemic, but it is not yet done with us.
Make no mistake about it, it's still circulating in our community.
I believe that the people of the City of Toronto will do the right thing and wear a face covering.
Hi there, welcome to Power and Politics. I'm Vashi Kapelos. A major policy decision today affecting several million Canadians. City Council in Toronto has just voted to make it mandatory, you can see the video of that there, to wear a mask inside public spaces, basically any space the public has access to, like grocery stores and other businesses. There's a Zoom-like City Council meeting on your screen there. Surrounding cities will likely follow suit. That's after the province denied a request from those cities' mayors to make face coverings mandatory right across the province. So what does this mean for you, and what happens if you don't comply? Bonnie Comrie is the mayor of Mississauga and Frank Scarpitti is the mayor of Markham. They are joining me tonight from their respective cities. Hello to both of you, mayors. Great to see you.
Hey, Vashi.
Great to see you, Vashi.
Mayor Crombie, I'm going to start with you. Update our viewers, if you could, on the plan for Mississauga. My understanding is this won't go before council for a few more days. And also lay out the case, if you could, for making these mandatory.
Absolutely, Vashi. Thanks for the question. So this is very much a precautionary measure. Now that we see the economy reopening, the risk of transmission is even greater. So we all want the same thing, and that's to avert that dreaded second wave that could come in the fall. So the plan for us looks like this. I've been consulting with my council. I've been hearing from residents, whether on town halls or on social media or just being out in the community, that this has to be mandatory because we know a lot more about this virus today than we did before, and how it spread and how it could be spread by an asymptomatic person, and that we've seen the experience in we've seen the evidence and the data in other countries that it did impose mandatory mask wearing. And now that we know we have a more secure supply of masks, it's the right time to do so. So we can get to phase 3 of our economy, keep businesses that are already open, and then welcome the next phase and allow new businesses to open and our economy to thrive. So that said, what it will look like, I made the announcement today, and on Wednesday, July 8th, we will have a council meeting. I know that my councillors are generally supportive. There is consensus among us that we move forward with this. We're letting our legal teams do the drafting over this period of week and get to the details and look at to see what Toronto has done, what Mayor Scarpitti and Markham might be doing, how Mayor Brown and I will likely be very uniform and very consistent. And then we will move to the Region of Peel on the 9th and implement a similar bylaw at the Region of Peel. And yes, it will include some infraction and measures of enforcement as well.
Mayor Scarpitti, I want to get into the question of enforcement in a second, but Mayor Scarpitti, what will it look like in Markham, and any hesitation on your part to make it mandatory?
Well, I actually moved the motion last week at York Regional Council to make masks mandatory indoors. And given that some members of council wanted to get some more information and to get a staff report, we agreed to hold a special council meeting on July the 9th. But look, this is just amazing to see the incredible momentum. I brought this up 2 weeks ago when we were meeting, when the announcement was made for stage 2 and businesses were opening up. And I can tell you that we did, as others have, made it mandatory on our transit system. It will start on July the 2nd. And there's really 3 key things here. We've seen how effective masks have been in other jurisdictions. In other areas like New York State, it actually helped flatten the curve. In other areas like South Korea, they didn't get anywhere near the percentage of cases because of masks. We've seen what reopening too early and without the proper measures can do. Just look at what's happening south of the border. And third, we really can't. This is both a public health issue, but an economic one. We can't have a false start of the economy. We need to make sure we're taking proper steps to ensure that the economy now continues to rebound, and that's by keeping everyone safe.
I want to go over for our viewers, just before I direct another question at you, Mayor Crombie, some of the evidence that both of you have referred to, because in preparing for this interview, I was actually astounded at, I don't know if it's as common knowledge as maybe it should be, and that's on me to get it across, but I'll point at one study, for example, published in Health Affairs, compared the COVID-19 growth rate before and after mask mandates in 15 states and the District of Columbia. It found that mask mandates led to a slowdown in the daily COVID-19 growth rate, which became more apparent over time. So the first 5 days after making it mandatory, the daily growth rate slowed by 0.9 percentage points compared to the 5 days prior to the mandate. At 3 weeks, the daily growth rate had slowed by 2 percentage points. Like there's even a case study of a man who traveled from China to Toronto on a plane, wore a mask the whole time, had some symptoms, a dry cough, and all 25 people around him did not test positive for the virus. Like, it does make a huge difference. And on that note, Mayor Crombie, I wanted to ask you, the Premier got a lot of questions on this as well. Should it be provincially mandated? And he was hesitant to go to that step and instead deferred to the authority of mayors like you and Mayor Scarpitti. Do you think that the Premier should be mandating this at the provincial level?
In a word, yes. And that's why the GTHA mayors have stepped up and done so. We appealed to him first and asked the Premier, please impose mandatory masks right throughout the province. And he said, no, those mayors who are interested, work with your public health officials and you can create your own bylaws. But I think rather than the patchwork approach, which we are now taking, it would have made more sense to have consistency and uniformity right across the province, because you never know. Look what happened to Kingston. They didn't have any cases either. Then someone was non-symptomatic and went into a nail salon, and suddenly they had 25 cases, and they imposed mandatory masks the next day as well. So I think there's a case to be made that this be done uniformly, consistently across the province, and we've all appealed as GTHA mayors to the Premier to do so.
Well, Mayor Scarpitti, what are your feelings on that? And do you think there's any possibility of movement in the Premier's office on this in the future once more municipalities, more cities start kind of jumping on the bandwagon?
Well, I've said throughout this pandemic, the province of Ontario issued the state of emergency. The province of Ontario should be coming up with the proper measures to deal with the state of emergency. Yeah, look, I give them full marks. They've done an incredible job. This is a bit of the irony here, where we have a Premier who is the poster child for wearing masks out in public. We've seen him pick up PPEs with his pickup truck. He's wearing a mask. He's out at a public event. He wears a mask. I understand the dilemma that the province is in, where rural Ontario has not seen the level of activity when it comes to COVID. So we were very specific. Right from the get-go, I've always called on the province to do things. Yesterday, we were very specific to say, we get it. You don't want to do it right across the province. At least do it in the large urban areas. And to your point, Vashi, this is a public health issue that is real. Masks work. When our medical officer of health tells us that if you've been in violation of the 2-meter distance for over 10 minutes, you should be self-isolating, that tells you the severity of the issue that we're all facing. And we have to avoid the spike in a second wave.
Mayor Crombie, you brought up enforcement. I want to talk about that because we heard Mayor Tory today say, it's not like the resources are there in Toronto to go out and, hand out tickets on this sort of thing. They're hoping for a lot of compliance in other areas. We have seen a high level of compliance. So I want to ask you how you plan, or if you plan to enforce this, should it go ahead in Mississauga? And second, how will you address the issue of affordability? And by that, I mean, if you're on public transit, there are a lot of people who use public transit or who might be going into businesses that don't necessarily have the means to procure a ton of masks. How might you tackle that?
So let's talk first about public transit, because just like Markham, on July 2nd, masks will be mandatory for all riders on public transit on our MyWay system. If you have forgotten your mask, we will have some extra ones and remind you to bring one next time. I think there is a great supply and availability at much lower cost now of PPE, so I'm not as concerned as that. On the enforcement side, I see this no different as enforcing other issues, like let's look at littering or fireworks or seatbelt wearing. In fact, that wasn't very popular. So this is about changing and modifying behavior going forward. Just people didn't like to wear bike helmets or ski helmets, walking their dog on a leash. These are all things that are difficult to enforce, but they're the right decision. So it's about asking people to step up and do their civic duty, do the right thing, and changing their behavior. So it becomes commonplace during this pandemic. You don't leave the house without your mask in your back pocket, have an extra one in your car. I've got one or two in my purse. I've been fortunate to have a few of those beautiful hand-sewn masks. I've got a few of the non-surgical masks in my car as well, a few extras in case people I'm with need one. So I think there are more and more available, but there has to be a bit of teeth behind the enforcement as well. So, whether this will be enforced by municipal bylaw or by public health, we're going to determine that for next week at our council meeting, and that's why we're doing the work we need to do through the course of this week. And there will be a fine involved too for those who are, let's say, not cooperative when asked to don their mask. And I could see a fine of $365, very similar to the fines imposed for walking your dog without a leash.
Mayor Scarpitti, I'll give the final word to you. I only have about 30 seconds left. How do you plan on enforcing it? And I would only note that, from the other areas we've heard about enforcement, it is difficult to do. And also there is some hesitancy to be too punitive about it, just because socially, as a society, we're not quite at the point that some other jurisdictions are where this is the norm. Although we want to get there, we're not there yet.
In other jurisdictions, you've seen over 90% compliance when the law was brought in. Just turn on your TV, look at your smartphone. If it's not evidence enough of what's happening south of the border, when you don't have the proper measures in place, you just see the evidence there. This is about getting ready. This is about being prepared. And we want to position our public to keep them safe and keep the economy growing.
Okay, I'm going to leave it there. Thank you very much, both of you, for your time this evening. Really appreciate it. Mississauga's Mayor Bonnie Comby and the Mayor of Markham, Frank Scarpitti. Thank you.
Thank you.
Wearing a mask will be mandatory in public transports starting July the 13th. Those not wearing a mask won't be allowed in public transports. This applies for everyone above the age of 12. For children between 2 and 12, we recommend a mask, but it's not mandatory. And children under 2 years old shouldn't wear a mask.
Quebec, as you heard there from the Premier, is making masks mandatory on public transit as of July 13th. It is the hardest hit province in Canada when it comes to COVID-19. To date, Quebec accounts for more than half of the country's cases and deaths, but it was also the first province to widely reopen schools and move more quickly to reopen its economy. The person who has been front and center in the province's handling of the pandemic is Dr. Horacio Arruda, Quebec's public health director. Dr. Arruda joins us now. Hello, great to see you. Thank you for making time for us.
Good evening.
I wanted to start off on the subject of masks, Dr. Arruda. There are some people out there who are expressing skepticism about whether or not they should be wearing them. What does the science tell us?
In fact, I would tell you that the first most important thing is the distanciation of 2 meters, and it's always the hand washing. But masks, actually, there is more and more studies telling that when there is a high proportion of people wearing masks, where they wear it well and keeping with other measures, there is a better issue on the cases. It will not prevent everything, but it will help a lot to protect others. So it's a very important issue, actually.
Here in Ontario, earlier in the show, we were talking to various mayors who are implementing mandatory mask wearing, not just on public transit, but anywhere basically indoors that's a public space. Are you considering that in Quebec?
Yes, we are. In fact, we are going to a step-by-step approach. We have learned people to understand the importance of the distanciation of 2 meters, which was a very important issue. It's the best thing to do. But at the same time, we know that in lifestyle, it's difficult to keep always the 2 meters. And it's why we are adding, I would say, new things like I would say, covering masks, which are going to be very important. Actually, we are going mandatory for, I would say, transportation, but depending of the rate and the level of application, because it's only recommended for a long time, for weeks now. I know it's summer. I know it's easy to forget that the virus is there, but it's very important. So we will make sure that people will be ready. And I think I would ask people from Quebec to try it and use it as a preventive important measure. And almost as when you keep your keys to go outside, you have to have your mask to make sure you wear it when it's necessary.
Yeah, I think you said a little bit earlier today it has to become a social norm. Because it isn't yet a social norm right across the country, do you think that the government in Quebec has to move more quickly to make it mandatory outside of just public transit? Like, what kind of metrics are you going to use to decide when to go the next step?
First of all, we're going to see how much people are using the mask. That's the thing we'll look at. And we will also be looking at the number of cases of hospitalizations and people dying. Greatly, the numbers are going down. It's great. It's why we deconfine a lot of industries and parts of the economy, which are important too. And also that we know the bad impact of confinement on the health, on the youth, and the health on the elderlies too, to be confined. But at the same time, we must make sure that we come to a normal life, but not the same one that we had before COVID-19. It's going to be a one with distanciation of 2 meters. And then with this new way of working, we're going to be able to, I hope, contain the impact of the second wave, of the different waves that are coming on soon.
You talked, Dr. Arruda, about the decline in hospitalizations and death due to COVID-19. Yesterday, we heard from Dr. Tam that while the number of cases, particularly in the older populations, are decreasing, which of course we know was a big problem in Ontario and Quebec, it's almost being displaced across the country by younger people contracting the virus. Are you seeing that in Quebec as well?
In fact, we always had some young people getting the disease. The issue is that they were not necessarily hospitalized or dying from the disease. It's normal when there's going to be more transmission in the community that we will observe more young people getting the disease, but the impact on them is going to be lower. But at the same time, those people can infect elderly people. It's why we think that we must make those be very cautious. It's great to get the confined, but it's in a conditioned way where we will not tolerate I will say places where we will not respect the 2 meters and all those situations for not getting outbreaks, like in bars. We've seen that there is some issues related in bars, and we're going to follow up those places where there is no distanciation of 2 meters, or at least the respect of the different protocols of public health.
And when it comes to those situations like bars, we've seen examples of the south of the border where that's where people can't maintain distance, they're not wearing a mask. Many of them are also, what we're seeing at least, or what we're hearing from public health officials, asymptomatic. I wanted to ask you about testing in the province and if you still plan on expanding testing to include people who are asymptomatic.
It's clear. We are going to do that. In fact, we had a problem. We don't have enough testing actually done. My Prime Minister and my Minister asked me to emphasize the importance of testing on asymptomatic people, especially the ones who will work in long-term care facilities, in hospitals, but also, I would say, in different parts of the deconfinement society where the risk of outbreaks is there. So we will have a new strategy based on asymptomatic people to proactively detect, I would say, outbreaks and react very rapidly with, I would say, case and control contacts.
When do you anticipate you will expand testing to include asymptomatic? Because it was a few weeks ago that you talked about the possibility of it. I'm just looking for, is there a specific timeline? And the reason I'm asking, I just want to ask for, sorry, 1 second, just give some context to our viewers. The reason I'm asking is Quebec had said that they wanted to hit 14,000 tests a day. Testing right now is hovering between 5,000 and 7,000 tests. It's been like that for a few weeks. So when do you plan to expand those parameters?
In the next weeks. And I would say I don't think that by the next week we're going to be at 14,000 tests, but I would say by the end of July, we want to be very aggressive. And I would say it's clear that there is less cases, and it's clear that there is less population who wants to get tested, like in other provinces, as in Ontario. There is a lot of clinics which are open, and there is not enough people coming to get tested. But we will have more aggressive strategies, actually, to make sure that we will test asymptomatic people, especially in high-risk settings.
Should the province have moved a bit faster to do that, given the inability to hit that target for so many weeks now?
I could say that, in fact, because we are getting in a low transmission, actually, and numbers, I would say that we should probably have more tests where there was a big concentration of cases in Quebec, which is not the case anymore. But we will do that back again to make sure at least that we will have the capacity and being very trained on, I would say, having a lot of tests when there's going to be some outbreaks, or I hope not a big wave, but some small waves.
Okay, I'll leave it there. Thank you, Dr. Arruda. Pleasure to have you on our program.
And thank you, and have a good summer. Be outside, but make sure that you have your hand hygiene, make sure you get your distanciation and your cover mask. It's very important.
Got it. Thanks, Dr. Arruda. Appreciate it. Dr. Horatio Arruda, Quebec's Public Health Director. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.